Most people believe that heart attacks happen suddenly, without any warning. One moment, a person feels fine, and the next moment, they collapse. But medical science tells us a very different story. In reality, your heart almost always gives warning signs before a heart attack. The problem is not that the signs are missing. The real problem is that people don't recognize them or choose to ignore them. This video is about understanding those warning signs, because knowing them early can save your life or the life of someone you love. A heart attack does not happen in one day. It develops slowly over months or even years. Inside the arteries that supply blood to the heart, cholesterol, fat, and inflammation start to build up. This buildup slowly narrows the arteries and reduces blood flow. As the heart receives less oxygen, it begins to struggle. When that happens, your body sends signals. These signals are the heart's way of asking for help, but many people brush them off as stress, aging, or tiredness. That is why heart attacks feel sudden, even though they are not. One of the earliest and most common warning signs is chest discomfort. This does not always feel like sharp pain. Many people feel pressure, tightness, squeezing, heaviness, or even a burning sensation in the center of the chest. Some describe it as feeling like something heavy is sitting on their chest. The discomfort may last only a few minutes, then go away, and later return. Because it doesn't feel extreme, people ignore it. But this discomfort is often the heart saying it is not getting enough oxygen. Another major warning sign is shortness of breath. If you feel out of breath while doing normal activities like walking, climbing stairs, or light household work, it is not something to ignore. Your heart is responsible for pumping oxygen-rich blood throughout your body. When the heart struggles, your breathing changes. Many people assume they are just out of shape or getting older, but unexplained shortness of breath can be an early sign of heart trouble. Heart-related pain does not always stay in the chest. It can spread to other parts of the body, including the left arm, right arm, shoulders, neck, jaw, or upper back. Jaw pain or arm pain without any injury is especially dangerous because people rarely connect it to the heart. Women experience this more often than men, which is why heart attack symptoms in women are frequently missed or misdiagnosed. Extreme fatigue is another warning sign that many people overlook. This is not normal tiredness after a long day. This type of fatigue feels overwhelming. You may wake up feeling exhausted. Simple tasks may feel impossible, and rest does not seem to help. Many heart attack survivors later say they felt unusually tired for days or even weeks before their heart attack, but they ignored it because they thought it was stress or lack of sleep. Some warning signs involve the digestive system and nervous system. Nausea, dizziness, cold sweats, and lightheadedness can all occur before a heart attack. People often confuse these symptoms with food poisoning, flu, or anxiety. Sudden sweating without physical activity, especially when combined with chest discomfort or shortness of breath, should never be ignored. Heart attack symptoms are not the same for everyone. Men often experience stronger chest pain, while women are more likely to feel fatigue, nausea, shortness of breath, and jaw or back pain. This difference is one reason why heart attacks in women are often missed until it is too late. Understanding these differences is critical for early action. Certain people are at higher risk of heart disease and heart attacks. These include people with high blood pressure, diabetes, high cholesterol, obesity, and a family history of heart disease. Smoking, lack of physical activity, poor diet, chronic stress, and poor sleep also increase risk. But it is important to understand that even young and physically fit people can experience heart attacks, especially if warning signs are ignored. If your body shows these warning signs, the most important thing is not to ignore them. Do not wait for severe pain. Do not try to push through the symptoms. If something feels wrong, it probably is. Seeking medical help early can prevent permanent heart damage or death. Calling emergency services quickly can save precious minutes, and in heart attacks, minutes truly matter. The good news is that many heart attacks are preventable. Simple lifestyle changes like eating a heart-healthy diet, Exercising regularly, managing stress, quitting smoking, controlling blood pressure and blood sugar, and getting enough sleep can dramatically reduce risk. Regular medical checkups help catch problems before they become life-threatening. Your heart works non-stop to keep you alive. When it struggles, it speaks through warning signs. The tragedy is not that the heart attack comes without warning. The tragedy is that the warnings are ignored. Listen to your body. Respect the signals. Acting early can mean the difference between life and death.